Hi, everyone, and welcome to your Chapter 1 lecture. All right, so we're going to start with something that might feel a bit broad at first, but I promise you this becomes the backbone of everything we do in this course. This chapter is actually about understanding what health education and health promotion actually are, and more importantly, how we move from just talking about health to actually designing programs that improve it. Now, whenever I look at a chapter like this, I don't just see a checklist like you might, but I see a roadmap. What you're really doing here is learning how to think like a health professional, and we're going to move from understanding what health means to understanding how behavior changes to eventually designing interventions. So don't think of these as isolated objectives. They stack on each other and everything connects. So let me challenge you on something right away. If I were to ask you, what is health? Most people would say something like not being sick, but actually that's a very limited way to think about it. Health is not just the absence of disease, it's a state of well-being, and not just physically. We've got to take into account social health, environment health, and occupational satisfaction. So immediately we now understand that we are dealing with an entire system and not a single outcome. So here's where things get interesting. We like to think that people are in control of their own health, but in reality, a lot of that control is shaped by their environment. Think about it for a second. Access to healthy food, safe places to exercise, high quality education, and income opportunities. These factors often matter, if not more than individual decisions. So when we talk about improving health, we can't just tell people to make better choices. We have to ask ourselves if these healthier choices are even available to make. This diagram becomes important because it visually reinforces something I want you to remember, that health is influenced by systems, not just behavior, not just knowledge, but systems. And this becomes critical later when we design interventions, because if we only target behavior without addressing context, we're setting ourselves up to fail big time. Now, because of all of this, health education specialists have to approach their work very carefully. You're not solving just one problem. You're dealing with lots of things at the same time: chronic disease, injury, basic needs, and behavioral risk. So humility here is not just a personality trait. It's actually a professional requirement. This is one of those moments in the field where we see everything beginning to shift. Before this point, healthcare systems got most of the attention, but then suddenly we're saying, hold on, doesn't biology and healthcare just tell part of the story? Isn't environment and lifestyle factors just as important? And this is where we start to see the shift from prevention and away from treatment. Now, we strengthen that connection between behavior and health outcomes. This is where things become actionable, because once we understand that behavior affects health, we can start asking questions like, how do we influence behavior? And that question leads us directly to health education. Healthy people becomes incredibly important because it takes all of this theory and it turns it into goals. National goals, structured priorities. And the most important thing for you to understand is that this is still being used today. So when you're working in health, you're not operating in a vacuum. You're actually operating within larger frameworks. Now, we can finally define health education. And this is one of those definitions you don't just want to memorize. You need to understand it. Because health education is about learning experiences. It's about helping people develop the knowledge, skills, and attitudes that they need so they can change their behavior. It's not just delivering information. It's creating structured and intentional learning. Health promotion takes that one step further. Sure, it includes everything in health education, but it also includes policies, environments, and systems. So if health education is the tool, health promotion is the entire toolbox, and you actually need both to create sustainable change. This visual shows that relationship a bit clearly. Health education sits inside of health promotion. So if someone says they're doing health promotion and they're only providing information, they're probably missing a whole bunch from this slide. This slide helps us answer the question, how do we actually influence behavior? Well, we do it through communication, but not random communication, through strategic communication, teaching, counseling, and media. All of these are delivery systems for behavior change. And this is one of the most important and practical frameworks in the entire chapter. The primary prevention level is a level in which we are trying to stop a problem or health concern before it starts. At the secondary level, we are trying to catch it early. And at the tertiary level, we are trying to manage this issue's impact. And every intervention you design should fit somewhere between these three. If it doesn't, you may need to rethink it. As we move forward, it's important to ground everything that we're doing. First, it's important to understand that behavior can change, but it's difficult. Health is dynamic and influenced by many moving parts. So if you're thinking, why don't people just change? Well, because it's hard and it's complex. These slides introduce the idea that this is a profession, not just a concept. There are certifications, there are standards, and competencies. So we're not just guessing here. There's actually evidence and structure behind everything that we are doing. What I want you to take from this section is that the field has evolved intentionally. People have spent decades refining what health educators do, what they need to know, and how they are trained. And that means expectations now are very, very clear. These are your core responsibilities moving forward. Everything in this course maps back to one of these: assessment, planning, implementation, and evaluation. You are going to see these over and over and over again. This framework is basically the structure behind your education. It determines what you learn, how programs are evaluated, and how professionals are certified. So this isn't just a theory, it actually shapes the field. Finally, this is where everything must come together. Program planning is how we move from understanding health to doing something about it. And the key takeaway here is that planning is a process. It is not a quick decision. It is not a guess. It is a very intentional process. So as we wrap up, I want to leave you with this thought. Health promotion exists because people care about improving health. And there's a lot of information out there, but the difference between good programs and ineffective ones comes down to planning. Good planning is intentional, and that's what we're going to build on throughout this course.